Welcome back to the health edition of TalkTV. We're here with Dr. Awad, and did I say it right again?
Yep.
Awad. Okay, and respiratory therapist Lionel Marshall. We're talking about sleep disorders, and you brought some equipment here to show us. Why don't we start off with that, and then we'll take some calls. This is a shirt with a tennis ball on the back?
Yeah.
Okay.
Yeah.
This is the back of the T-shirt, and let me just show the folks here how this works. And then there's a tennis ball inside. All right, what is this for?
Lots of people have a problem with snoring. And after checking out snoring and speaking to the family physician, if there is no evidence for a serious breathing disorder that we call sleep apnea, which is very common and as common as asthma, there are different types of interventions for snoring. This is called behavioral management, where people who sleep on their side are much less likely to snore than when they sleep.
Stops you from sleeping
Absolutely.
on the back.
So the way you wear it, if you go on your back, you feel it, you move to your side, and then the snoring becomes much less. And lots of bed partners find it effective and easy to apply kind of a method.
A nice elbow to the back works too.
Well, it causes lots of tension and marital problems later on.
Not to mention bruising. Okay, and this is, I know what this is. This is a CPAP.
Yeah, CPAP is the most effective and the most reliable form of treatment for sleep apnea. And sleep apnea, as you did mention, is a very serious disorder, and when people are diagnosed and needing to get help, they wear CPAP at night. It's
how can you sleep with that thing on?
Believe it or not, people sleep much better with it and feel much better the following day. Some people get used to it right away, not a problem, and some people may take them 2 to 4 weeks.
And it just keeps giving you continuous oxygen?
It's not an oxygen. This is a normal, it picks up room air, pumps it under pressure that is determined at the sleep clinic to make sure it is enough to keep the airway open, and then you breathe throughout the night.
And it's attached to this machine?
Yes, attach it to the machine.
And the problem with sleep apnea, it's not just about snoring, it's not just about being tired.
No.
It's also linked to heart disease.
Heart disease, high blood pressure,
heart attack,
strokes, and last week we have had evidence of association with diabetes. Last week they found that people who have significant sleep apnea have a very high level of sugar at night. So now we are talking about the most significant medical disorders that people suffer from, and sleep apnea have a very negative impact on all of those.
And it's not the heart disease that causes sleep apnea, it's not the diabetes that causes sleep apnea, it's the other way around.
It
contributes to it.
It does contribute to it, and it does aggravate the symptoms and also makes it very difficult to manage.
Okay, let's get to the phones. I know a lot of people who are trying to stay awake and want to phone you guys. Brian is our first caller. Hey, Brian.
Hi.
How are you doing?
I'm doing great.
How's the sleep?
Oh, well, my question is really, how damaging is it to you when you're on a sleep cycle, like say for work? I work in shift work, and sometimes I work at 4 o'clock in the morning till 2 in the afternoon, and then a week of doing that shift, a week later I will be working at 12 in the afternoon till 10 at night. Sometimes I pick up shifts, so sometimes I'll be working at 4 till 2, but then the next day, 4 till 2, and then the next day I work from 12 till 10, so changing your sleep pattern like that, how damaging is it to you, or, how bad is it for your health?
It is unfortunately bad for your health, and it is damaging. And it's a major issue that the North American industry is trying to address. But obviously,
we need shift workers.
You need shift workers, and definitely need people working 24 hours a day.
In hospitals
and everywhere. However, the best you can do is to minimize the damage. And how minimizing the damage, if you can have a minimum of 3 days a week, allowing yourself regular sleep cycles, and a minimum of 2, then you are at much less risk than if you are doing it 7 days.
Why is it so damaging? If you're getting that 8 hours regardless, why is it so damaging to get it?
The 8 hours number is really irrelevant. The relevant is the quality of sleep. Because if you look sometimes at sleep pattern of somebody who's sleeping 8 hours, you would say they would rather be awake than sleep. If the quality of sleep is so restless, people are fretting throughout their sleep, waking up, unable to get any continuity, then the sleep, in fact, becomes a nightmare and becomes more of a damaging problem.
And I guess if you're trying to sleep during the day and you're working a night shift, you know, there's the issue of sunlight coming in.
Definitely.
And that's part of that sleep hygiene we talked about. A dark room is preferable.
Sleep environment, and that is very crucial to maintain as much as possible.
And I guess, too, Brian, during the day, you're hearing noises outside your window, you're hearing trucks and all of that stuff, and light coming in and all that.
Yeah, it was very difficult at first, and then I got used to it really quickly. And I never used to be able to nap before, like take a quick half an hour, what my friends would call a power nap. I didn't understand that term, and now from working in shift work, or sometimes getting 5 hours sleep, I can take a power nap in the daytime, and I'm like, I can really notice changes in my sleep pattern.
But that is also a problem. When people nap during the day and perceive that as a good thing, we have a problem, because
you should be able to fall asleep during the day.
And you are chronically sleep deprived. You are not getting adequate regular sleep, so you are trying to compensate for it by napping during the day. And if you happen to be driving or behind a machinery and you are overpowered by one of those naps, then we have a serious problem. And
I can't even get more than 5 hours sleep. Like before I could get, before I did shift work, I worked 8 hours, or I'd sleep for 8 hours, but now I automatically wake up in 5 hours, even if I have a day off.
Yeah, that's fun.
Yeah.
And also,
you can't really catch up on sleep, right? That's a misnomer.
No, that's a very important message. You cannot catch up on sleep. If you lose it,
you lose it.
You lose it.
Okay, well,
Thank
Brian,
you very much.
okay, good luck to you. Dario's our next caller. Hey, Dario.
Hey, how you guys doing?
Okay, how's your sleep?
All right, I guess. It could be a little bit better. I just got a quick question for you guys. I usually won't...
You have a loud dog that doesn't allow you to get to sleep, right?
Yeah, you know what? It's the dog. That's another problem, too. The dog won't shut up, but... I don't usually fall asleep until, like, 4 or 5 o'clock in the morning, and, like, even if I'll get up the next day at, say, like, 9 o'clock, 8 o'clock in the morning, I still, the next night, I won't be able to sleep till late.
4 or 5 in the morning? What are you doing until 4 or 5 in the morning?
You know what? Like, watching TV, I guess. But even if I try to fall asleep, say I turn off the television, I turn off all distractions, I'll just lie in my bed awake till, like, 5 in the morning.
Okay, sounds like he needs a sleep refresher course.
He needs professional help.
Okay, you need professional help, Dario.
Okay.
Did you speak to your family physician about your problem?
No, not really. I haven't.
See, people don't think of sleep as a medical issue, right?
Yes.
They think, oh, I'll get back on track, and I just haven't been
They
able
minimize
to...
it.
Yeah, they do minimize it.
Yeah.
But really, we all need sleep, and it's so important to everything else in our body.
It is absolutely crucial to physical, mental, and psychological well-being. And that is a very important message to get across, because...
You get sicker when you don't sleep?
You get sicker. Your immune system is down.
Your digestive things don't work?
Absolutely. You mentally are not as sharp. Also memory. Like lots of people, very young people complain about poor memory. Why is that? If you don't get proper sleep, memory is consolidated during our sleep.
Okay, so you can absolutely go to your family doctor and ask for a sleep disorder clinic referral?
Absolutely, and discuss your problem with him, and I encourage you to explain to him how long you have been having a problem and what kind of impact it's having.
Pills aren't an answer.
I mean, when it comes to management of sleep disorders, there are lots of options available. It depends on the condition, on the diagnosis, on the person, but you need to go and consult with your family physician, talk to him openly about it, and get help, and help is available.
But I think people are afraid to go to their doctor about it because they think they're going to get the prescription, but that's not necessarily what your doctor will do for you.
I think now there is a significantly increased awareness on the part of the family physician in terms of sleep disorders, and they are going to inquire about the problem and take whatever referral to a sleep clinic, consultation, advise them about appropriate sleep hygiene, and so on and so forth.
Okay. All right, good luck, Dario. We have to take a short break. We'll have more of your calls ahead, so call us right now with all your questions and your sleep disorders. We'll be right back.